From increasing Head Start slots to programs that empower small community-based providers to political advocacy efforts, there is a reason for optimism. Let's dig in.
%90 of a child's critical brain development happens before the age of 5. I heard someone say once, like, our system treats children like they're born at 5. But when we don't tend to everything before that, we're really missing out on those really critical years to set them up for success, to intervene early, to make things run smoother after that. It's the capacity piece, like provider, Tracy painted that picture. You're working from at least 6 to 6, like you're with children, that's exhausting. You're managing a team, you're a business person, you're a curriculum specialist. Like, it's just the bandwidth it takes to then go through a state portal, submit documentation, or do these types of things. And so, we've worked to support programs and kind of getting them to access those pre-K expansion funds. And so, for example, we had, out of the 6 new childcare providers in the city last year that were awarded public pre-K seats, which, by the way, is far above any other jurisdiction, 5 of them came through our support cohort, and they, in our follow-up surveys, they would not have applied or been able to access public pre-K if they didn't have somebody helping them. Like, they would not have done it on their own. And anecdotally, that's what I'm seeing from providers that are doing public pre-K. They're either from larger centers that have some administrative support. They the director can take some time out of the day to work on this. For those especially really small centers, there's just very little bandwidth to then go above and beyond what they need to make their bottom lines meet.
Lifting and supporting these primarily women who are taking care of our children. Really, it's brain science, what they're doing, right? It is every day. They're wiring the brains of our young children, and we need to be supportive of the work they're doing.
And we don't need any new wheels to invest. We're there supporting, I think echoing on what both Rudi and Josh said, investing in the organizations that are out in Baltimore City doing this hard work, so to really lift up the early care education ecosystem.